Hello everyone and welcome to my presentation about Doctors Without Borders, or MSF. Throughout this presentation I'll be using photos directly from their website to help highlight some of the ideas that we go over. So to begin, I want to talk about their mission, values, and impact. So their mission is to go where people's needs are greatest and to provide neutral, impartial, and independent emergency healthcare to people affected by disaster, disease, conflict, and exclusion. They offer basic healthcare, perform surgery, address epidemics, rehabilitate and run hospitals and clinics, carry out vaccination campaigns. They operate nutrition centers, provide mental health care, and offer training to local medical staff. Some of their values are impartiality, neutrality, independence, and medical ethics. Impartiality means that they see all human beings equally, and because of that, they offer medical attention and care to whoever needs it, not excluding people. Neutrality means that they do not get involved with so oftentimes they go into war-torn areas, and because of that there's sometimes conflict going on, and they choose to remain politically neutral to help prevent problems with their organization. Independence means that they have 90% of their income that comes from private donors, generally mainly from the general public, and because of that they don't have to conform to whoever's funding them. They can just they can provide care based on need alone, which is really cool. Medical ethics just means, just like doctors here in the US, they don't provide care that would cause harm to individuals or groups. Okay, here's some statistics that I thought were really interesting. So on the right is a figure with their impact in 2023, which is really cool. And then I just added some more on the left that I thought was really interesting, especially where they provide 80% of staff from countries where the aid is being given. So they help support communities by providing work for them, which is really cool. I won't go through all of these, but I invite you to pause the video and read some of these facts because I think they're really interesting and highlight kind of the work that they've been doing. Okay, now I want to move on to some of the crisis responses that they've had. So here's some photos from the Ebola epidemics from West Africa and the Dominican Republic of the Congo, or DRC. So from 2014 through 2016, about 11,000 people died from Ebola. What's really interesting about Ebola is that it's estimated that between 25 to 90% of those who get infected will die, which is really interesting how huge of a range that is. And we don't really understand a whole lot about Ebola, especially with the death rate with that. But what we do know is that it's an important thing an issue to fight against, and so that's why they took it on, and they've gone into West Africa and the DRC to help provide clinics and train professionals to curb these outbreaks. They've educated communities around prevention, and also when the vaccine was approved they started administering it and even gave it to 350,000 people from 2018 through 2020 in the DRC specifically, and helped overcome vaccine hesitancy there, which is really cool. Help prevent some of those outbreaks from occurring again. Okay, now I want to talk about the Syrian civil war, which has been over a decade of help. They started in 2011 helping out with this, and during that time they provided these things that are listed here: 1.1 million outpatient consults, over 40,000 routine vaccines, helped families with relief items, provided hospital systems, and helped with births and C-sections, and provided mental health consults. And there's just some photos from the area. But what I think is really cool about MSF is that or Doctors Without Borders, they just go into these communities. They go into war-torn areas or emergency situations where healthcare systems have been decimated by either war or natural disasters or some other consequence. And they take the medical attention and care to the people that need it most. And they don't care about who you are or where you've been. They go and provide care. I think that's something so crucial, and what we've learned from our class is just providing care in the way that the people need it and the way that'll be most effective to them. And I think MSF does a great job with that, and that's why I wanted to give my presentation on this amazing organization. Thank you for listening.